Welcome to the Psychedelic Mindscape, a podcast that delves into two fascinating topics: psychedelics and leadership. I'm your host, Victoria Lauren, and today I'm speaking with Dr. Douglas Wingate. Doug is a doctor of Chinese medicine with postdoctoral studies in clinical neuroscience, a certified hyperbaric clinician, psilocybin facilitator, and co founder of Seven Gates Sanctuary. That's a service center located in Portland, Oregon. He has been specializing in integrative neurorehabilitation of traumatic brain injury, stroke, PTSD, and other emotional, neurocognitive, and chronic pain conditions for 15 years. He is additionally certified in somatic psychedelic integration and works with the Integrative Psychiatry Institute's Psychedelic Assisted Therapy program. He has written multiple books on the topics of brain health and consciousness, and lectures and teaches to international audiences on topics ranging from integrative medicine, brain and body healing, trauma, and psychedelics. Doug, welcome to the show.
Thank you so much. Really appreciate you having me on. I'm looking forward to the conversation.
Me too. So we met at the psychedelic convention in Las Vegas, and I had the pleasure of listening to several of your talks that you gave on neurorehabilitation, specifically post-traumatic brain injury, stroke. And I'm just really fascinated to hear more about your work of the combination of neurorehabilitation and psychedelics. So I want to open to that story. But if you want to give the audience kind of a sense of your background or kind of like where you're coming from or how you got into this work, that could also be a nice place to start.
Sure. Yeah, I'm happy to give a little bit of background. As you said, I've been in clinical practice utilizing integrative neurorehabilitation for the last 15 years. I got into integrative neurorehabilitation because of my own experience with some central nervous system damage at a young age, so early teenage age, that caused a lot of chronic pain and disrupted my gait. I still sort of walk with a limp, and as a result of that, I looked into a lot of different options and ways that might both alleviate the pain and allow for more functionality, and spent a good number of years trying just about any intervention, going to a wide range of specialists. And the reason that I ended up getting into Chinese medicine in particular is because I gained a lot of benefit from that. It alleviated my pain in a way that no other method had. And I didn't really understand how it did that initially. I just knew somebody had finally recommended it. I went and tried it. It alleviated my pain. They were putting a few points in me, and then my pain would go away. And so I wanted to understand that. I've always been fascinated just kind of with how the body works, always been fascinated with the intersection of emotions and the body, and how the body holds on to particular emotions, and how that plays into overall health and wellness. So there was a great intersection that sort of led me on my path to try to understand that further, and then ultimately make a career for it, and looking to offer essentially what I had gotten in situations where people may often feel like there are not a lot of options, or they're just kind of sent on their way to find their own path, and hope that things get better either on their own, or they'll find something that works well. So that's how I got into that realm, specifically with traumatic brain injury and post stroke. That came about when I was finishing up my clinical rounds in medical school, and um, realizing I had the opportunity to connect with a neurooptometrist here in Portland, Oregon, who does some really amazing work with individuals with TBI, and seeing how much benefit people were getting just by working with their visual system. Getting a proper pair of glasses can be immensely helpful in terms of dizziness and alleviating headaches. And I saw that a lot of people are suffering. I mean, millions of people have a traumatic brain injury a year, and are often just sort of after the acute rehab, they're sent on their way, and as I said, hopefully they find resources, or they're sent to sort of best of luck. Hope you continue to heal type thing. And seeing how Chinese medicine may have a lot to offer with that. That was a direction that I specialized in and really focused in, did the research in, and have now literally written the book on Chinese medical interventions for traumatic brain injury. And there's a lot of research out there in relation to stroke and neuro rehab and the intersections with how Chinese medicine can help with that. And then from there, I continued my postdoctoral studies with the Carrick Institute and their clinical neuroscience program. They're sort of at the forefront in terms of a lot of the research and ways that you can clinically work with that and continue to see improvements in a lot of different interventions. So that's one whole facet, and then there's the psychedelic realm, which was sort of its whole other thing. I think, like a lot of people, first exposure to psychedelics was relatively early on in more of a recreational setting, and I've always been fascinated with the human condition and what is possible in this human experience, whether psychedelically related or not, just in terms of what we're capable of doing and what we're capable of experiencing. So, doing things like I've been meditating since I was 8 or 9, and that's been a regular practice. I've done things like the sensory deprivation tanks and darkroom experiments and different things that allowed for naturally inducing altered states of consciousness or just exploring consciousness. So between that personal interest and then that led to I'm also a giant book nerd and always looking for more information. So ran into people like Stanislav Grof, who was sort of that intersection again. His holotropic breath work that induces altered states, but also his research in terms of psychedelics early on, and I had the opportunity to study under Robert Anton Wilson, who's an author, who then introduced me to a number of other authors that were tangentially related. So the work of like Timothy Leary, and then consciousness explorers like David J. Brown, who I've now had an opportunity to work with and co-present a little bit, which has been a really incredible experience. So it. Throughout my 20s, I was really fascinated with this material, but given that my career path was in an above board medical capacity, psychedelics didn't really lend themselves until very recently, when in Oregon psilocybin became legalized, and as soon as that became an option to pursue above ground and in a legal setting, I signed myself up, got into the very first program that was available in Oregon, was among the first class to finish up training, and was the fourth person in the state of Oregon to get a legal psilocybin facilitator's license. So it's been quite a journey, and now I find myself with all of those things kind of converging in a very interesting way.
That's beautiful. That is beautiful. I'd love to know, in terms of the psilocybin service center that
Mm-hmm.
you co-founded in Portland, just how working in that space and in combination with individuals, like I'm thinking about who are the type of people that you really find it meaningful to work with, given your unique background and understanding of TBI stroke. Are those the types of people that are coming in to work with you
Well,
in that setting?
definitely initially, it was really interesting for me clinically because I'm seeing 80 to 90% of my patients that I'm seeing in a clinical setting at any given time have had a stroke or a TBI, and so the conversation began changing when Oregon passed Measure 109 and legalized psilocybin. Even before service centers and licensure was available, all of a sudden the conversation changed. A lot of people were asking a lot more questions about it, whether or not it was appropriate, and a lot more people were willing to sort of divulge that they had been exploring that already on their own, in an underground sense or in a recreational sense. So that was really interesting to see, and certainly initially that's a lot of individuals that I have already worked with in a clinical setting, and so a lot of people are interested in how those things can or cannot, or whether or not what situations are appropriate in terms of overlap. So there's that. I throughout my clinical experience, I worked with a lot of veterans, and so a lot of complex trauma comes into play, and not just in the veteran community. I mean, I've been working with PTSD and complex traumas throughout my practice. Um, since I've gotten started. So there's also that component. It's been really interesting to see the type of population that we the Oregon model for psilocybin is a non-prescription model. So in theory, anybody can come and seek out psilocybin services for whatever reason they so choose. If it's self-exploration, if they're wanting to work with or sit with particular traumas or do any intentional work in that sense, that definitely comes into play. So it's been really interesting to see the different populations and types of people who are coming in. For instance, a lot of us facilitators have been really surprised by the age of people who are coming in. There was sort of this expectation that it was likely to be, the younger generation, people in their 20s and 30s, and many people several decades older than that have been coming in, and that's been a decent percentage of the individuals coming in, which I think is great. They're finding a lot of benefit and getting a lot out of the experience, but I think it was a bit of a surprise, a, a good surprise, a pleasant surprise to see that.
Yeah. That's what I've heard for the service centers in Bend as well, that it is an older population that's coming in, and that there was kind of that sense of surprise. But
Hmm.
also, I'm just so happy that people are seeking it out and that people are interested. And to me, having this legalized, um, I wouldn't call it like a fully medicalized model, because it's not like in the clinical trial settings where you've got
Hmm.
the two therapists, and it's this full on like psychotherapy plus
Right,
psilocybin or plus
right.
MDMA. It's
Yeah.
different,
A
but I
lot of
think
the
we're
structure is still based out of that. I mean, in
right.
terms of there is a preparatory session, and then there's the administration session. And while Oregon doesn't mandate integration, that's built into the structure as well. So some of that got pulled in, but you're absolutely right in terms of having dyads and multiple therapists there providing interventions, as opposed to the Oregon model, which is a non-directive approach. We're really just holding the space and allowing for a safe container environment for that experience.
Yeah, exactly. Well, I'd love to dive into the science a little bit here. And
Hmm.
I have had Manesh Gurn from UCSF on the podcast before
Hmm.
to talk about neuroplasticity and kind of what's happening
Sure.
in the brain. So,
Yeah.
safe to assume that the audience has like baseline understanding of
Hmm.
neuroplasticity. But the thing
Right.
that really struck me in your presentation, you were talking about post stroke. There
Hmm.
is this period of natural increase in neuroplasticity. So i want
Right.
to i want to hear more about that, as well as using psychedelics for the neuroplastic benefits, and what how that can actually support someone after they've gone through a stroke or after they've had traumatic brain injury.
Yeah. So after any sort of significant neurotrauma like stroke or traumatic brain injury, as you said, there is a spike or an acute increase in neuroplasticity. The reason for that is your brain is in a highly adaptable state, trying to tend to the trauma that's happened. So if there's direct tissue damage, it's trying to clear that up and recreate the neural connections as best as possible. If there's significant enough damage and those uh, neural connections can't be spared, then there are new connections being formed. And so the natural body response is for an acute period of like, oh, we need to get in and create as many connections as possible and heal as quickly as possible. So that's neuroplasticity, that ability to initiate change, an ability to create those new neural connections. And when it comes to things like traumatic brain injury and stroke, As you sort of alluded to, there's this sort of prime window where this neuroplasticity is most optimal, most active, and at some point that starts to wane and ultimately considered to close. And so a lot of what I was talking about at the PsyCon talk is some really interesting research that researcher Gul Dolen is doing in terms of the critical windows. And she's been taking a look at this with a number of different psychedelics in a number of different capacities. And she started working or taking a look at um, sociability. So the first study that she did was with octopuses and MDMA. So octopuses are notoriously not social creatures, and
Right.
so with the administration of MDMA, they found that octopuses were more social. And so then they extrapolated this and began doing additional studies of, hey, how does this translate beyond just octopuses, a totally different species. And so her more recent research has been in terms of critical windows of sociality initially, and whether or not it translated beyond MDMA to include psilocybin and LSD and ketamine and ibogaine were different ones that she looked at. And it did. And so what's been found is that psychedelics have a tendency to reopen critical windows of development. And there are a lot of critical windows of development that happen in the human experience. Many of these are early in life and developmental. So things like the visual system, like if, at an early age, as long as you're getting appropriate visual intake, um, that then within this critical period of development where all these neural connections are happening, then what would be considered normal visual development happens. And the same sort of thing with motor development. So um, if somebody doesn't have enough stimulus or doesn't utilize their motor motions during these critical periods, it's very difficult, if not impossible, to really make up for the lost time. In a sense, they can make some headway, but ultimately it won't generally be the same as if um, the young human had that stimulus or was able to engage the muscle system or the motor system during that critical period. So goals work that I had alluded to in pertaining to stroke is now taking that and applying that critical period of neuroplasticity that happens following a stroke or a TBI, any significant neurotrauma. And the fact that that tends to wane over time, and that psychedelics may reopen these critical windows. It may reopen another period of time in which there's acute neuroplasticity is the broad term. Gul Dolen likes to talk about metaplasticity, and there's a difference between those, or that there's some particular elements of metaplasticity that are relevant to neuro rehab and relevant to critical periods. Meaning, metaplasticity is the ability for, or how much um, plasticity can be elicited. So, clinically, when I'm working outside of the psychedelic realm, but in any of the integrative neuro rehab interventions, metaplasticity applies to how those intervention, how well somebody or the degree to which somebody is going to respond to a particular intervention or multiple interventions. So there's a lot of different elements that can come into play. Meaning it can be anything from what they are ingesting. So psychedelics or nicotine or alcohol have different effects on the body and how somebody is going to respond. Some better, some worse. Time of day, everything down to mood, other things that you're having them do. So you can stack therapies. You can have somebody do multiple interventions simultaneously. For instance, if I'm doing acupuncture or photomyomodulation to stimulate areas of the scalp, I'll often have them, if they have trouble moving an arm, I'll have them move the arm while stimulating those areas of the brain that have to do with the motor cortex to help complement those and ultimately get a better effect. So that's metaplasticity, is how well and how much plasticity can be utilized or can actually happen. And so that comes into play with the psychedelics as well. and in terms of opening these critical periods of metaplasticity. So the idea with stroke being that generally the ideal period to get in following a stroke, or to do as much as possible on the rehab side of things, you're talking like 2 or 3 months is the optimal window. 6 months, it really starts to wane and is pretty well closed. And in my practice, I often see people who come in 6 months, a year, several years after a stroke, and we have to have a very real conversation about, this prime therapeutic window has kind of waned, and I'm happy to see what we can do, but it's going to be an uphill battle. And general recommendation is, if you've had a stroke, if you've had a traumatic brain injury, to get in as early as possible and do as much as possible so that you're still working within this window where your body and your brain and your nervous system is most receptive and most adaptable. Um,
Sure, sure. Do you know what happens when, like, let's say that someone's in that kind of ideal window of,
mhm.
like they've just recovered from the hospital and they're back home to that 3 month mark. So you've got the natural increase in neuroplasticity. If you were to combine that with a psilocybin session at the service center, does that, like, how much more does that increase neuroplasticity? Is it like something that you can stack?
So in theory, because a lot of that is speculative right now when working within that critical window. So, like I said, Gul Dolen's research right now that she's pursuing with the what she calls the Fathom project is reopening those critical windows to allow for that. Generally speaking, when it comes to any sort of um, neuro neuro rehab intervention or anything that increases neuroplasticity, I mean, there's certainly a cap to that. But being able to, that's a lot of the reason behind stacking multiple therapies, even if it is, stimulating an area of the body and then having them move. All of those things can build upon one another and be helpful. It's the That hasn't been explicitly looked at with psychedelics in the therapeutic realm. um, but something also that's really important to keep in mind is there's a particular metabolic threshold that is sort of a set point of how much your body is able to do following a neurotrauma. There can be a little bit more flexibility with that with stroke, generally speaking, but not always the case. But certainly with TBI, and certainly it comes into play with stroke too, is being very cautious about not overdoing it, not overstimulating the nervous system. A lot of people will be very sensory sensitive. So photophobia, they'll have increased light sensitivity, they'll have increased sound sensitivity, and to the point where many of my patients will come in and they're wearing sunglasses all the time, anytime that they're out, and they're walking around with noise canceling headphones because the stimulation is too much. There's too much information coming in. And so when that is the case, psychedelics increase sensory information coming in. And so if the nervous system is already prone to sort of being overloaded with sensory information, it can be actually problematic. So anytime in relation to any intervention or anything that a person is doing following stroke or TBI, taking into account what's going to be too much, what's going to be asking too much of their nervous system or of their body at any given time. And it can sometimes be very easy to overtreat, even with very subtle interventions. So a lot of my intake and my assessment has to do with seeing where they are and how much we're able to do at any given time. The idea being that we're getting the body to re-regulate itself so that it can take in and do more and heal more thoroughly. But sometimes it's not uncommon following a TBI, for instance, that people end up sleeping a lot more. And we're talking 12, 14 hours a day, and they're still feeling tired because it's their body and their nervous system is taking so much energy just to try to heal the tissue and reconnect those neural connections. So it's really a delicate balance when taking into account any sort of intervention, and whether or not it's appropriate to stack things or not stack things, or um, how much to intervene and how much to stimulate the body. So definitely can be a delicate balance when in those sort of situations.
That makes sense. I remember you had talked about that, when you're working with a patient, that there might be interventions stacking or unstacked, but then you're also kind of allowing for this period of rest. And it's almost
Hmm.
like that is allowing them to take up this new information, or really like for the body to integrate what that intervention did. Is that
Yeah.
is that a fair way to
Yeah,
express that?
that's a fair way to look at it, and there's some variance in what's appropriate for any given person. So sometimes just a single intervention and then giving it a little bit of time. So I might have somebody come in on a weekly basis. Other times, and oftentimes, as long as their body is in a place to do so, you're not surpassing that metabolic threshold where it's demanding too much, and they feel just laid out afterward. Is to do sort of um, blocks of treatment. And so the nervous system itself responds very well to consistency and re-stimulation. And so within the clinical neuroscience realm and within my own practice, a lot of the time the recommendation is to come in and do a sort of intensive. So that's coming in on a daily basis for 4 or 5 days out of the week, and then taking a break after that, or doing a 2 week regimen where we're coming in 4 days a week, uh, take 3 days off, 4 days a week, which is how we've built out the microdosing program at the service center as well. But both of those are very much in line with how the nervous system responds. So sometimes interventions are recommended multiple times a day. So, for instance, we may do acupuncture early in the day, photobiomodulation, which is laser stimulation to the body, later in the day, and there's a certain time period in which the nervous system responds, and then and it's activated, and then a few hours later it begins to wane. And so if you give it a little bit of time in between to maximize the response of the nervous system, it can be beneficial to do those multiple interventions with a little bit of time. But once that intensive happens, allowing for a greater period of time in between for the body to integrate all of that information that's just come in and sort of reestablish a sort of baseline. So it's a rather it can be a rather heavy, intensive treatment regimen for a period of time, and then allowing that space to reset or rebalance and refind itself before approaching it again and seeing where things are at and whether or not the treatment protocol needs to be changed, different interventions are appropriate, what that metabolic threshold might be following that treatment protocol. There's a lot of variance, and when it comes to these neurological conditions like stroke and TBI, it's a situation where no injury is the same. Everybody is a little bit different. You have to have a really individualized approach, and so there's no across the board recommendation of like absolutely consider psychedelics. No, not by any means, especially given the state of the research. But also when it comes to um, you know, photobiomodulation or massage or across the board any sort of intervention or functional exercises, some variance in functional exercises. It's always individualized because everybody is impacted differently and to different degrees after these sorts of injuries.
That makes sense. Yeah. And like in the case where you were saying, if a patient is struggling with just kind of that sensory overload, they got the sunglasses, they got the sound canceling headphones on,
Yeah,
that's someone that you would probably say, "Ooh, psilocybin, not a good route for you right now."
probably not the best fit.
Probably not the best fit. Are there other things that kind of clue you into, "Ooh, let's not look at that," versus candidates where you think, "Oh, this would really be helpful"?
Well, I mean, generally speaking, when it comes to psilocybin and psychedelics, it's not recommended that they be taken during any um, significant shifts in one's life, or where there's a lack of general stability or support anyway. So when you're talking like an acute neurotrauma like that, I mean that's significant and can be life changing. And So just broadly speaking, if somebody is going through a lot emotionally in their household, or they're considering a move or something like that, that's probably not the best time to give consideration to psychedelics, because you're going to be in an altered state that induces entropy anyway. It creates a degree of instability that allows for the initiation of change. But when there's already a lot or there's already a lack of stability, it can be even more jarring or more destabilizing, and that's problematic. So you want to that's part of the whole prep session and discussion with somebody, whether or not it's going to be appropriate, whether neurotrauma or not. There's a lot of different factors that come into play, and life circumstances is definitely one of those.
That makes a lot of sense. So I'm kind of picturing like if someone was, say, in a car accident and they've got some kind of head trauma, from that. And we want to take advantage of this neuroplastic window, but at the same time jumping straight into pairing whatever work you're doing clinically with psilocybin, because of how traumatic that may have been. Like, that timing might not actually be the right time. You might want to focus on getting the nervous system calm, grounded before opening that door.
Yeah, so again, just generally speaking, anytime that there's significant instability or significant life changes, it's not the optimal time to consider psychedelics, and tend to wait on consideration until things are a little bit more even keeled or a little bit more stable, so that there's not any compromising emotionally or physically.
Yeah, that makes sense. I am curious because you had mentioned your work with veterans and complex PTSD, and I'm curious about the difference in approach between the subset coming in for an acquired brain injury or stroke versus someone coming in with complex trauma. Like, how does that shift your work and your approach?
Um, Sometimes it does, and sometimes it doesn't. Only because a lot of the time within that community, their comorbidities. A lot of the time, they're both in play. So a lot of the people that I treat who are in the veteran community have history of blast injuries or brain injuries, as well as the complex emotional trauma, PTSD, CPTSD. So they're not definitely not always mutually exclusive. That being said, just like I kind of said broadly, and it's an individualized approach depending on where somebody is at. So, uh, offer if it's more of an emotional trauma, and I talked about this a little bit at the end of my psychon talk too, is that even neurophysiologically, neurobiologically, like there is physical trauma associated with, and there are key findings of brain change that you can find following emotional trauma and in PTSD, and these have been well researched and well sussed out, so it's well established that there is a physical component. There tends to be shrinkage, or certain brain areas like the hippocampus, the memory centers, tend to become smaller following emotional trauma. And then the amygdala tends to become hyperactive, and there tends to be associations in different areas of the frontal lobe too. So there are these physical components, and then a TBI is this physical trauma that's causing physical dysfunction in the central nervous system as well. So it's not super clean cut by any means, but there are different approaches depending on where somebody is at. So if somebody needs more emotional support, or knowing that certain emotions may come up, or holding space in a different way, versus if somebody is having more physical symptoms following a motor vehicle accident or whatever, and they've hit their head, a lot of the impairment, it can be emotional. It can also be cognitive, which again, PTSD and emotional trauma can inhibit cognitive function. And so you have a lot of people with complex traumas who complain, or say that they have brain fog too. Their cognitive function is not as ideal as they'd like, and so even more overlap there. But in terms of interventions when working with stroke and TBI, a lot of the time it is more of a physical component. So again, at the Psychon talk, I talked about this context dependent interventions, meaning that introducing or complementing these states of increased neuroplasticity with active movement and exercise and stretches that are appropriate, or neurorehabilitation, physical therapy, um, a host of different things. We mentioned the VR as well, and I know you wanted to talk about that at some point. So all of those things come into play, and it depends on where somebody is at. So there's, when it comes to more of the emotional stuff, some additional reassurances that sometimes those traumas can come back to the surface, and different tools that people can use to be able to manage that or work through that, and reassurances and support networks in place for those sorts of things. So there's some variance, but there's also a lot of overlap. Like I said, it's a lot of the time it's a lot more muddy than like, this is what you do with PTSD and this is what you do with a stroke.
Yeah. Yeah. It sounds like it's very much an individualized and kind of personalized medicine approach.
For sure.
And the one thing that I mentioned when you and I met, I used to work for a digital health startup that was doing gait and balance monitoring
Yeah.
for individuals with movement disorder, so Parkinson's, ataxia, MS. And so I'm just thinking about that population of like neurodegenerative diseases and the
Hmm.
research that's going on. Because I know you had mentioned something about like Alzheimer's, for example, and
Yeah.
psychedelics. So
Yeah.
anything you want to share?
I mean, there's only so much to share at this point. That research is very much in its infancy, but it is starting to be done. And much like the TBI realm, for a very, very long time, traumatic brain injury or history of brain injury or significant history of trauma was an exclusionary criteria for research, because it's complex. And so when you're trying to analyze the data and see what's coming through and how people are responding, it's very hard to suss out, well, how much of this is coming from the head trauma. And it's the same sort of thing with neurodegenerative diseases. It's also I was going to say a touchier, it's not necessarily a touchier subject, but it is a complex subject that can, I guess, confound a very clean linear research study, especially if it's geared more toward the emotional side of things, as much as the research has been done. So, research studies are just starting to form, and discussion is just starting to form around neurodegenerative diseases. And you're right. At SciCon, I had cited a fairly recent study that had just come through where they had taken a look at DMT, the hallucinogen, and its possible benefit in Alzheimer's disease. Now, to what extent that is, or whether or not that's a acute benefit, long term benefit, that research hasn't been able to really been undertaken to any significance. So it is a very new realm. What the discussion is around is that psychedelics have demonstrated positive effects in reducing neuroinflammation, as well as decreasing oxidative stress and creating greater global communication between brain areas. That's where a lot of the neuroscience has taken a look at, as far as what psychedelics are doing on the central nervous system, and allowing for, at higher doses, this greater global connection or communication, and allowing for these communication channels to become more efficient. And so, taking a look at that, when you're looking at neurodegenerative diseases, there's this it's now being hypothesized and just starting to research, that it may hold some degree of benefit, but to what extent, not able to say yet. Really, really interesting realm, and uh, think if what's being speculated should bears out in the research, I mean, it would have huge potential for millions of individuals, but remains to be seen at this point. Like I said, it's very much in its infancy. It's just starting to be taken a look at. So very exciting times for sure.
Yes, it is. I am curious if you can talk about like just the difference I don't know if those studies are particularly working with like a macro dose versus looking at microdosing,
Hmm.
or if you've got anything that you want to share on kind of the difference, because obviously some people are more open to microdosing, less
Yeah.
so to macro.
Yeah, macrodose can be intimidating. It's an intense experience at times, so that's understandable. Most of the research that's being done is with macro doses. So usually with the higher doses, with psilocybin, most of the studies are being done with 25 to 35 milligrams of psilocybin, which it's hard to convert that into what people generally think of in grams, but it's a higher dose, and it's definitely a psychedelic experience that they're having with that. There is some research taking a look at microdosing as it relates to neuroplasticity, and they compared microdosing and macrodosing in mice and found that in terms of neurogenesis, the generation of new neural connections and new dendrites on the nerve cells, that microdosing demonstrated greater neurogenesis than the macrodose, whereas macrodose, the higher dose, demonstrated more of an affinity for that global communication between brain areas. So dose dependency does seem to be in play. The research on microdosing is significantly less in a research setting than macrodosing. I mean, there is a self report population study, microdose.me, that has tens of thousands of individuals who have self reported their own experience with microdosing, and fortunately, that's now integrated in different tests within that, that people can do. So it's all self-reported. It's open to error, but when you're talking tens of thousands, that's a huge data pool of people. What I often reference with that is the finger tap test, which is a test that's often used to gauge motor function and tends to wane with age. So they'll use it to gauge in Alzheimer's disease and Parkinson's and things like that. They'll do the finger tap test and see what tends to happen is that tapping your fingers tends to slow down over time as the nervous system is not functioning as well. And with the microdose.me studies, they've found in older populations, these individuals, their finger during or following microdosing, the finger tap will actually speed up. And when it comes to neurodegenerative diseases, the expectation is that just continues to get worse and worse and worse. So what you're seeing there is an objective measure that's often used clinically to gauge things like neurodegeneration, and you're seeing improvements in this. So you're seeing heightened and improved neural response, and so that's also um, a very positive sign and very hopeful sign, that there is this benefit.
That's amazing. I wonder, are you willing to share just, your guys' approach to microdosing and the protocol? Because like you're saying, there's not a ton of research and, there's various protocols, Fadimans, Stamets
Hmm.
stacks, do you guys use one of those or have you kind of created your own?
Yeah, so you're right. There are a number of different protocols for microdosing out there, and the Service Center offers microdosing in a couple different ways. One of those is that because the way the organ is laid out, anybody can pursue psilocybin for whatever reason. So we do offer just single microdosing sessions that people can come in um, outside of like a regimented protocol. And then we also have a 2 week protocol where microdosing is done 4 days on, 3 days off, 4 days on, 3 days off. So this is sort of adapted from more of the Paul Stamets protocol. Fadiman is more of 1 day on, 1 day off, 1 day on. And like I sort of touched on with the other neurorehabilitation interventions, is that the nervous system tends to respond very positively in terms of seeing improvements or increasing neuroplasticity, or increasing levels of brain-derived neurotrophic factor, or increasing stimulation of tract B, all of which come into play in both neuro rehab integrations as well as psychedelics. elicit that response in the body as well. So I talked about these sort of intensives where you have several days of the stimulus to the nervous system and then a few days of break, and the stimulus to the nervous system within these blocks, and then a few days for the body to integrate again. And so we've sort of taken that principle and made an offering of having that readily available in that 2 week regimen of 4 days on, 3 days off, 4 days on, 3 days off.
That makes sense. Do you have anyone that's coming in to do the microdosing for chronic pain? Is that a reason that someone might seek it out? I'm kind of curious what people
Mm-hmm.
are looking to get out of the experience.
Yeah, we've definitely had people asking how psychedelics influence or might impact chronic pain conditions for sure. There's some really interesting research that has been done for that. They were doing research during sort of the first wave of psychedelics in the 50s and 60s. There's some really interesting stuff in terms of functional pain disorders or functional neurological disorders as well. Um, and that is definitely a question that comes up. And I usually cite psychedelics again have demonstrated to have this gross uh, anti-neuroinflammatory effect or anti-inflammatory effect. There are certain situations. I had somebody ask me yesterday about peripheral neuropathy, so which often comes up either post chemotherapy or diabetic neuropathy and things like that. And these can be very intense, long-standing pain conditions, chronic pain conditions. And something to be very aware of with that is that, again, going back to psychedelics, increasing the amount of sensory input that's coming in, is that during a psychedelic journey itself, um, it stimulates their serotonin receptors to such a degree, and the sensory input is heightened to such a degree that it can actually increase the pain levels during the experience itself. And so I always want to make sure that somebody is aware of that. But there is also some really interesting research that's being done in terms of chronic pain, certain chronic pain conditions, and sort of um, to put it simply, almost like hitting the reset button on the nervous system in terms of it allows for this global communication within the brain, but it also decouples or breaks certain long held communication pathways. And so it can temporarily break those pathways and allow for the brain to readapt into a different pattern. And so if the brain is kind of caught in this pain loop, the idea is that this loop may get a hard stop or a hard reset to it, and then uh, potentially alleviate uh, some of the chronic pain conditions.
Yeah. I'd love to know just for your personal experience, because you had talked about this thing that had happened in childhood
Hmm.
and that, working with traditional Chinese medicine was kind of the first time that you were able to alleviate some of that chronic pain.
Hmm.
And I'm guessing that also kind of inspired, it sounds like you started a meditation practice very early on.
Hmm.
So I'd love to know just, what have kind of been your favorite tools for working with that, whether for yourself or
Uh-huh.
for others.
With chronic pain,
Yeah.
yeah. Definitely, again, born out of my own experience and seeing it over the years. Chinese medicine can be very effective for getting in there and alleviating pain conditions. The research on that is just continuing to grow, and it's being used in a hospital setting now. I worked up at an OHSU in their neurology department for a number of years, primarily focusing on peripheral and polyneuropathy. So all these chronic, real acute pain conditions. No, excuse me, chronic intense pain conditions, not acute. And so I utilize that a lot. I also utilize photobiomodulation. All of this is usually coupled with some degree of exercise or movement to the ability of the individual. All of that creates just more feedback to the central nervous system while activating the peripheral nervous system. So the more that you can get those two communicating and in harmony and rebalancing or balancing themselves, I've found you tend to get the best results, again, within the capacity of the individual. So That can be a wide range of different physical therapy or exercise interventions. But again, going back to neuroplasticity, like one of a really great way to increase neuroplasticity without any sort of real intervention is regular exercise. So coupling that again to the extent that an individual can, because sometimes I get people that like walking to their front door and then back to the couch is the degree of exercise that they can get, and then you steadily increase that as their body begins to heal and be able to do more and more, meeting them on that end. A lot of my focus and my research interest is in non-invasive brain stimulation techniques. So that is transcutaneous magnetic stimulation, or TMS, which is a big magnet that's placed over certain areas of the scalp. Transcutaneous electrical stimulation. Acupuncture is a manual means to do that. So there's a lot of research demonstrating how acupuncture over the scalp stimulates those areas, particular areas of the brain. So we can, if we know a particular area is affected, we can then work with that. Photobiomodulation, as I mentioned, is the use of light. So particular wavelengths of light to stimulate, and same sort of thing. It's been shown, and there's some really great books summarizing the research in terms of stimulation of brain areas that way through the scalp, or intranasal photobiomodulation. So there's a device called a V light that I recommend or I utilize a lot, because it does go in the nose and uses a light. And the reason for that is the membrane between the nose and the capillaries of the brain, during in the bottom frontal area of the brain, is very thin. So it's the most direct way to stimulate um, the vascular system within the brain. And so the photobiomodulation has been shown to increase mitochondrial function within the blood that gets essentially irradiated or affected by the light. And so it's a very direct means of increasing mitochondrial function, which mitochondrial dysfunction can be a major issue when it comes to um, a lot of these neurotraumas. And again, people feeling very fatigued or just laid out, or having to sleep for very long periods of time. Often that's because the body is demanding so much energy to do everything and to be doing this healing, that if you can support that mitochondrial function so that hopefully the body has more capacity for healing, that's a very direct way to do that. So that's a lot of uh, the big interventions that I integrate in. You did mention that I'm also a hyperbaric oxygen therapy clinician, and I've seen some pretty amazing results with people utilizing hyperbarics following stroke and TBI as well. So much so that that's why I went ahead and did the training. Is I had patients who were coming in and seeing me, and then when they started coupling, or when those things were coupled, the pace at which the recovery happened was stark. Started looking into that more and more, and now that's something that I regularly offer. Again, when appropriate, it's definitely individualized, and whether or not it's appropriate for somebody. But there's another big one that I've seen some really significant clinical results with the neuro stuff.
That's really cool. The one thing that I wanted to make sure I got to, because you had alluded to it before, was this use of the digitally enriched environments, or
Yeah, for sure.
virtual reality, and the
Hmm.
psychedelics. Like, what is happening in that realm?
What's going on there?
What's going
Um,
on?
Yeah, I mean, we're definitely at a point now where VR is within the cultural milieu. Like people are much more aware of it. It's being utilized in recreational and in homes and playing games and things like that. And there are um, now apps or programs within VR that are focused on neurorehabilitation for one. So that's being utilized more and more in a clinical setting in terms of neuro rehab. That augmented or virtual environment sort of either gamifies certain motions. So if somebody is having trouble with arm motion, for instance, which happens a lot post stroke, if you can gamify that or have this visual environment where they're more um, visually engaged, it can be helpful, or having them do particular movements. So, just generally speaking, with neuro rehab, if you can gamify something, um, it tends to most of the time be more effective because there's like this reward component. You feel good about it, you get a dopamine rush, and it's self-rewarding. So if you're like getting points for every time you reach up and virtually grab an apple off of a virtual shelf or something like that, like it feels good and you get all this immediate positive feedback. So that comes into play, and something that I utilize outside of the psychedelic realm. And then there are those that are exploring, including Gul Dolen's work, in term with stroke, in terms of opening the critical window for neuroplasticity or metaplasticity, and integrating that in with physical therapy and VR assisted neuro rehab techniques. So again, that gamification, and I do the same thing with intake and neuro exam too. And all there are a bunch of apps now that you can just have on your phone, including ones that do the finger tap test that I alluded to or we talked about. And it sort of gamifies those, like you get so many points depending on how fast you can tap, so it increases that reward circuitry of wanting to do better and better and better. And so that's sort of built in as well. And so we'll use that in exercises, or that'll be their homework, is to run this app or this game um, that is not only rewarding and feels good to do, and you want to do it because it's fun, but is also very good for the brain and body in terms of rehabilitation.
Yeah, that's amazing. Oh, wow. I'm super fascinated by that. I want to know, do you have time for one more question?
Yeah.
All right, this is a fun one. So, given all of your various realms that you work in and your expertise and your background and the research that you currently see happening, if you had unlimited resources and could do any clinical trial, psychedelic research, neuro rehab research, if you could, with unlimited funding, do a study, like what would that be? What do you want to see happen in this research?
Yeah. I mean, that's a great question, because I think I'm very passionate about my work with traumatic brain injury, and there are so many millions of people that are affected with long-standing chronic issues going with that. And as I said, it's been historically an exclusionary criteria for most research because it's so complicated or confounding. And I think I love what Gul Dolen is looking to do with the Fathom project in relation to stroke, and bringing in that context dependent. Um, Context dependent research or interventions in conjunction with psychedelics. And I'd say probably something very similar to that, but working with the individuals with post concussion TBI. Like I said, a lot of these veteran communities that have confounding comorbidities of TBI and uh, significant emotional trauma. So probably steer it in that direction. Do something fairly similar. I think she's doing amazing work, and I'd love to see something like that related to brain injury as well.
Amazing. Thank you for that. Well, where can people find you? I know you've also authored several books.
Hmm.
Where's the best place to get connected with you or to just learn more about your world?
Yeah, so in general, my website acuneuromodulation.com will bring you to sort of a central hub of all things that I'm doing. I have a number of other websites, some related to more of the psychedelic realm. 7gatesanctuary.com, the number 7gatesanctuary.com is the website for the service center. And then that has a lot of information specifically related to the psychedelic work. But those would be probably the two, depending on what people are looking for.
Amazing. Amazing. Dr. Douglas Wingate, thank you so much for coming on and sharing your wealth of information today.
Oh, absolutely. Thank you so much for having me.
My pleasure.